Hello and welcome to Lyra. In this video we're going to talk about hypertension. Is hypertension the cause of cardiovascular and cerebrovascular diseases? Is the high blood pressure the cause of strokes and heart attacks? What are the real causes of hypertension? Should you be worried when your blood pressure is over 140 to 90? Should you take beta blockers? Are there natural remedies that work much better? These questions and many more will be answered in this presentation, so let's get going. But before we do that, if you enjoy this type of content, please become a Patreon and support us directly. You can also support us via a small PayPal donation. It really helps us out a lot and keeps this channel going. Links in the description box below. And also, of course, do not forget to like, share and subscribe, and also hit the notification button and get involved in the comment section below. Thank you so much for that. And now, to the subject at hand. What is hypertension and what causes it? It has been accepted over decades that blood pressure must be around 100 plus the age. For example, a person of 70 years should have a blood pressure of 100 plus 70 equals 170. But then in 2008, the WHO set up a new blood pressure limit at a maximum of 140 to 90 regardless of age. And millions of people since then have been administered beta blockers, and they've lost the energy, the libido, the joy of life. So they experience all of these side effects, and unfortunately we did explicit presentations on that. These beta blockers can still not prevent a stroke, a heart attack, pacemakers, stents, bypasses or cardiac death. To this day we have no scientific evidence and proofs that the blood pressure must not exceed 140 to 90. So where is the truth then? Well, cardiovascular and cerebrovascular accidents occur when people are in continuous stress, overwhelmed by occurring life problems, and of course there are also some physical causes that we're gonna discuss. A high blood pressure is a body mechanism to adjust to age, environment, unhealthy burdening lifestyles and habits, especially to these psychogenic stressors. It is not necessarily a disease. The secondary causes of hypertension are medications, drugs, alcohol consumption, specifically medications with sympathicotonic effects such as cortisone, antibiotics, immunosuppressive drugs, and chemotherapeutics. There are also problems with the blood vessels, smooth muscles. When you are in a permanent conflict active phase, for example, due to life issues and worries, you are in a permanent fight or flight conflict, sympathicotonic adrenaline depleting state, and that can cause blood pressure issues. The left myocardium ventricle must also enhance its cardio work due to a permanent compensatory effect of the right ventricle. And this is the case when the stress is hanging on a track with alternating conflict active, conflict resolution phases. A stroke or a cardiac event is usually happening during the night or the evening when the active conflict is being revived through dreams. Kidneys, when there is a strong abandonment sensation, a frustration, a loneliness, overwhelming conflict that is active over time, the filtration tissue of the kidneys is being reduced and more blood pressure is necessary to compensate the filtration function loss. This is a compensatory blood pressure due to renal hypotonia. If this biological conflict is hanging with permanent filtration tissue damages followed by repair, the blood pressure will remain high to compensate and secure a good filtration rate. The kidney arteries also, they contract and they narrow. This is called a stenosis in situations when you cook of rage, so to speak, and cannot relax. The kidneys sensors send signals of low blood pressure due to the reduced kidney filtration rate, and the body will adjust accordingly the blood pressure with symptoms such as dizziness, morning headaches, and hypertension. Increased thyroxine values rise the blood pressure also due to the sympathetic or tonic effect, with symptoms such as weight loss and palpitations. And hypertension due to cortisol spikes, for example in the so-called Cushing syndrome, also this high blood pressure due to an increase of dopamine or adrenaline secretion in the adrenal medulla, so overfunction here, with symptoms such as sweating, shaking, and blood glucose spiking. In this case, there are extreme tensions in your life preventing you to reach deadlines or goals. It may temporarily build a carcinoma even on the adrenals. So blood pressure is a regulative process which responds to many factors, including the health of the heart, the blood quality, and the blood vessel flowing capabilities. And contrary to what many people believe, findings from embryology have shown that the heart is not a mechanical pump pushing blood through the blood vessels. The blood is instead propelled by its own electrical potential force created between positive charged red blood cells and blood vessels, which are negatively charged. The lungs are actually the pump, and the heart is a valving system which directs the blood through arteries and arterioles. In the capillaries, the blood is flowing naturally based on vortexing, so on a whirling. In nature, fluids move in a spiral manner. It has therefore been proven that the structure of the cardiovascular system is taking full advantage of this natural tendency of fluids to spiral. The rotary motion of the heart, which happens in the left ventricle, and the blood was detected and measured by several researchers as early as 1908 by James B. Pettigrew, for example, professor of medicine at St. Andrews University in Scotland. He performed dissections of the heart and discovered that the heart has 7 muscle layers. Pettigrew postulated that one group of muscles contracts during systole while the other stores energy that is utilized in a diastole. In his view, the motion of the heart muscle is like that of a torsional, so a twisting pendulum. This was published in the book Design in Nature 1908. In the 1920s, then, scientist and philosopher Rudolf Steiner taught his medical students that the spiral flow in the blood vessels of the embryo was propelled by its own biological momentum, initiated in the tubes that eventually become the heart. The heart is only aiding this process. In Psychoanalysis and Spiritual Psychology, Steiner stated, quote, "The pressure is not a cause of the blood flow, but the result of it." End quote. In 1932, then Howard University scientist J. Bremer filmed the blood flow in embryos before the formation of the heart valves. He observed that the spiraling blood is boosted by the pulsating heart without creating turbulence in the blood. He described 2 streams in the heart tubes that spiral with different forward velocities around their own longitudinal axis and around each other. And Bremer's findings were confirmed in 1981 by the surgical studies of A. Arbulu and I. Asfaf, who stated, quote, "Not only is the blood flow well maintained in the embryo before the formation of the valves, there are reports of adults in whom both infected tricuspid and pulmonary valves were surgically removed and not replaced by prosthetic valves without significant problems." The Austrian researcher Victor Schauberger, celebrated for his extraordinary discoveries of the energy effects of water whirls, stated on many occasions also that the heart was not a pump, but that the function of the heart was rather that of a regulator of blood flow. He saw the peristaltic and pulsatory action of the blood vessels as the elements responsible for the blood circulation. So let's look a little deeper into how blood flow happens. According to Professor Kurt Bergel of Berlin University, the function of the blood flow was carried out by the millions of highly active capillaries permeating the body. Bergel had detected this pulsation by observing the small blood vessels that formed around the yolk sac of a bird's egg. Upon opening the egg, he noticed that blood vessels surrounding the yolk sac pulsated before they cooled off, although the heart had not yet been formed. Ralph Marinelli of Temple University in Philadelphia wrote, quote, "When the heart begins to function, it enhances the blood's momentum with spiraling impulses. The arteries serve a subsidiary mimical heart function by providing spiraling boosts to the circulating blood. In so doing, the arteries dilate to receive the incoming blood and contract to deliver an impulse to increase the blood's momentum." This was published in the book The Heart is Not a Pump in 1995. The spiral theme is apparent in the function and form of the heart and the blood vessel. The spiral shape of the inner surface of the blood vessels, the temperature differential between core and extremities, and the electromagnetic charge differential between arterial, so oxygen-rich, and venous, so CO2-rich blood, also seem to support circulatory action. The musculature of the heart and arteries all the way down to the precapillaries is spirally oriented, and both the heart and the arteries move spirally to augment the momentum of the blood. And the heart moves the way it does because of its bundles of striated muscles, which are oriented spirally in the same direction and work together to effect motion. In 3D, healthy hearts do their own version of twist. Rather than a simple pumping action, they circulate blood as if they were wringing a towel. This was published in Harvard School of Engineering and Applied Sciences in 2014. Modern analysis of the heart has shown that the amount of pressure required to force the blood through the entire length of the body's blood vessels would have to be able to lift a 100-pound weight 1 mile high. Given that the human body contains at least 60,000 miles, or about 96,500 kilometers of blood vessels, it is inconceivable that a heart would be capable of producing sufficient power that is needed to circulate the blood. Wrapping up all of these findings, the blood pressure is a result of many physical, electrical, chemical, and psychosomatic factors, which all synergistically optimize the blood flow through the body. How can you explain then limits such 140 to 90? Well, you can't. And usually people with a healthy heart are friendly, warm and loving, their mind is clear, their emotions are balanced, and they go effortlessly through the problems of life. People with a healthy heart are dedicated, empathic and caring, and people with heart conditions are usually restless, they laugh excessively or do not laugh at all, and manifest an overall strange, inappropriate behavior. Their minds are scattered, their spirit is weak, and they are unable to focus. Severe manifestations of a sick heart are mental illnesses. If the heart is weak, the mind has no residence and wanders, so to speak, homelessly at night, and thus the heart problems always manifest with insomnia. People with unbalanced heart have trouble falling asleep. Their sleep is shallow, interrupted, unproductive, and dreams disturbed. And the heart governs the blood, and since it is responsible for supplying blood to all body tissues, a healthy heart and abundant blood will manifest in the radiant, peach-like complexion, while flushed or white pale face indicates a heart-blood disharmony. The sense organ that the heart opens to is the tongue, and therefore the heart controls also the speech. Any speech problems, including impairment of language ability, called aphasia, stuttering, excessive speaking, or confused speaking, indicates heart imbalances. Spontaneous sweating or night sweats are also commonly related to a deficient heart. And of course the heart likes the summer and the beautiful radiant summer's colors, especially red and green. In TCM they speak of a so-called overheated heart. The causes for that are the major ones: stress, overworking yourself and lack of rest, but also chronic worries and anxiety, and liver conditions such as hepatitis, an inflamed liver, a fatty liver, bile blockages in the ducts, infectious and parasitic diseases such as fasciola hepatica, which also transmit the heat to the heart, and also kidney conditions due to their special role in regulating the water metabolism. The kidneys' filtration function is directly regulated by blood pressure. Symptoms are heart palpitations, mental restlessness, insomnia and dream-disturbed sleep, anxiety, night sweats, hot palms and sores, dryness of skin, internal mucosa, eyes and mouth, thirst for icy cold drinks, an aversion to heat. Overheated heart manifests also with a red face, severe mental restlessness, agitation and impulsiveness, mouth and tongue ulcers. Also dark urine, blood in the urine, and a bitter taste in the mouth, which are all liver symptoms, might be also present. Treatment: you select cooling foods and herbs which are best for this pathology, and cool herbs should not be taken excessively and on a long term because they are cold in nature and will eventually slow down the digestion and damage the spleen. Let's look then at natural remedies for overheated heart. Red, as we've discussed already quickly, is the color of the heart. Thus red foods have a nourishing effect for the heart. So watermelons, red radishes, tomatoes, red grapefruit, they have both the color and the taste of the heart, so red and bitter, and they are therefore great heart cooling foods. A well-recommended food that also builds heart cells is the oyster shell. An overheated heart is also a consequence of kidney weakness, therefore foods which tonify the kidneys like asparagus, string beans, kelp and grapes, and all foods with both sweet and sour flavor, most of the fruits fall into this category, are beneficial for a weak heart. Kidney tonifying is a complex therapy which targets also the tonification of the lungs, the stomach and the spleen. And some helpful herbs here are Taxilus chinensis, Eclipta prostrata, Ligustrum lucidum, Sesamum indicum, Asparagus cochinensis, Ophiopogon japonica, Adenophora tetraphylla, Panax quinquefolium, Dendrobium nobile, Polygonatum odoratum, and Althea officinalis. Another way to clear the heart from the heat is to pacify the mind. Whole wheat, also brown rice and oats, have a gentle mind calming effect, as do the spices dill and basil. Herbs such as catnip, skullcap, and a very bitter tasting valerian also subdue nervousness and treat insomnia. And the red schisandra berries and jujube seeds calm the spirit and profoundly nourish the heart. And one of the best therapies, natural remedies for heart problems is G-strophantine in a good concentration, such as 3 milligrams per pill, which has a strong anti-stress effect and regulative action on the heart metabolism, and supports also the optimal heart oxygenation. It can stop heart attacks, heals angina pectoris, and regulates the heartbeat. Another option in TCM is that you have a so-called weak heart. The causes here are chronic or excessive negative emotions, sadness, grief, and depression. An energy deficient heart is also a common problem for the contemporary person because we live very stress-filled lifestyles. We suffer from poor diets, so bad quality food or poor food combinations, also poor breathing. We live also in polluted areas many times in big cities and with a lot of industry that pollutes the air. And we overwork ourselves and wear out the energy. Negative emotions also, since the heart houses the mind, according to TCM, emotional problems of any kind wear out the energy of the heart. The emotion most responsible for heart energy depletion is sadness, as sadness is experienced with a physical sensation of pressure in the heart area and heart restriction. Symptoms to look out for are heart palpitations, heart disharmony of any kind, which manifests through heart palpitations, spontaneous sweating, shortness of breath, tiredness, paleness, cold sensitivity, fear of cold, shallow breathing, cold limbs and blue lips, and symptoms of heart collapse which are weak and shallow breathing, cold limbs and blue lips combined with heart palpitations. The treatment is to energize and tonify the heart and also to tonify and activate the blood and cleanse the blood of pathogens. And this can be achieved through the following natural means. Foods that tonify and nourish the heart and the blood are all red and slightly sweet foods and herbs. Foods with intense red color, such as beetroot, red cherries, hawthorn berries, red sage root, red yeast rice, and reishi mushrooms are excellent for building up blood, which consequently will strengthen the heart. And also the foods must be consumed warm to warm up the body. As deficient heart energy also affects all other organs, treatment of a weak heart needs to be treated holistically, like any other condition. If there are general energy deficiency signs such as shortness of breath, spontaneous sweating, chronic tiredness, paleness, apathy, then the lungs, the spleen, the kidneys and the liver must also be fortified. Spleen energy deficiency symptoms are poor energy, lack of appetite, feeling tired after meals, gas and bloating, and loose stool or diarrhea. Lung energy deficiency symptoms are shortness of breath, dislike to speak, overall weak immunity, and coughing. A kidney Qi deficiency shows itself through frequent urination, dribbling after urination, urinating at night, incontinence, and enuresis. Some herbs that help tonify the heart are motherwort, radix ginseng, Cordonopsis pilosula, Pseudostellaria heterophylla, Dioscorrera opposite, Astragalus membranceus, Atractylodes macrocephala, Sisyphus jujuba, Polygonatum sibericum, velvet of deer antler, sea cucumber, Dipsacus asper, Drinaria fortune, Euchomia ulmoides, and Cascata chinensis. Next, let's look what you can do about blood deficiency. The causes here are that the liver stores and regulates the blood in the body, and therefore overall blood deficiency, so not enough blood or toxic blood, will affect the function of the liver. These hard blood deficiency symptoms are spirit related, as the heart houses the mind. Such symptoms are therefore nervousness, anxiety, insomnia, dream-disturbed sleep, and poor memory. Another major cause of blood deficiency is a weak spleen. When the spleen is weak, it cannot sufficiently transform food into nutrients, blood, and energy. And thus not enough blood is being produced. If this is the case, blood deficiency symptoms such as paleness, dry skin, and dizziness are accompanied with some digestive issues like poor appetite and/or poor digestion. A diet which lacks sufficient nourishment is another cause for the blood to become deficient. And another possible cause is severe hemorrhaging as well, so bleeding. Symptoms to look out for: pale face, pale lips, pale nails. Even having a pale tongue without other paleness means that the blood is deficient. Dry skin, dry hair, thin hair, premature graying of the hair, muscle weakness, muscle cramps and muscle spasms, numbness in the limbs, dizziness, scanty menstruation, painful menstruation, blurred vision, floaters in the eyes, dry or cracked nails, as well as heart palpitations, nervousness, anxiety, insomnia, dream-disturbed sleep, and poor memory. The treatment is that we need herbs which are heavy and sticky in nature, and they should be also subscribed with caution, as they could be heavy on the digestion as well. On the other hand, they are very potent and strongly reinforce this blood deficiency, or they help get rid of it. So for better effect, it is good to use them together with some qi tonifying herbs. Recommended herbs and natural remedies here are Rehmannia glutinosa. This is a processed herb that strongly tonifies the blood and it addresses body substance loss, manifesting in night sweats and nocturnal emissions. It also improves hearing, prevents premature graying of the hair, lightheadedness, and dizziness. Polygonum multiflorum, so fleece flower root, also strongly tonifies the blood and supplements life essence. The essence is responsible for the length of our lifespan as well as the speed of our aging. People using this herb long term stop graying of the hair, blurred vision, weakness in the lower back and knees, and poor sleep. It also can treat malarial disorder due to blood deficiency. Angelica sinensis, commonly referred to as the woman's herb, is also recommended. It tonifies blood and regulates menstrual disorders due to blood deficiency, such as scanty, painful menstruation or lack of menstruation. It also has a moving quality, thus it is used for pain due to blood stasis. Paeonia lactiflora is another famous blood tonifier that regulates the menses also. It also preserves and harmonizes the liver and the digestion. Equus asinus L tonifies and nourishes the blood and stops any kind of internal bleeding. Euphoria longan enters the spleen and the heart and calms the spirit, especially the heart-spleen related disturbing emotions such as overthinking, which comes from the spleen, and anxiety, which is related to the heart. Lycium barbarum or West Goji or goji berry is considered a longevity herb and also nourishes the blood. Nettle nourishes also the blood and benefits the hair, restores the connective tissue, and promotes lactation. For weakness and exhaustion, anemia, and lack of menstruation, nettle can also do wonders. Chicory intybus nourishes the blood and relieves fatigue, benefits stability from overwork and chronic illness, childbirth, and surgery. And artemisinin another one of the best therapies to cleanse and tonify the blood. It penetrates also the gallbladder and the liver meridians and dissipates blood stasis. There is also a bunch of vital supplements that can help you maintain a healthy cardio and cerebrovascular system. L-carnitine, for example, is an amino acid found in nearly every cell of your body. Carnitine plays a vital role in the production of energy, and carnitine turns body fat into energy. It helps get rid of toxic compounds from the mitochondria to prevent their buildup, and is produced by the liver and kidneys and stored in the muscles, the brain, and the heart tissue, all of which use fatty acids as energy. It is abundant in meats and improves exercise tolerance in people with chronic angina. It also reduces chest pain, increases glucose metabolism, blood flow, and also corrects abnormal heartbeat. Next on the list is L-arginine. This is also an amino acid that plays many different important roles in the body. Amongst these are regulating the blood pressure and the circulation via nitric oxide. Particularly rich sources of arginine include fish and especially walnuts, which have as much as 15% of the amino acids being comprised of L-arginine. L-arginine can also be made from citrulline via the proximal tubule cells in the kidneys. Most of the L-arginine in the body is used to process ammonia into the less toxic urea, as well as to synthesize creatine and ornithine. A small portion is then used as a precursor to nitric oxide, a compound which dilates the blood vessels, lowers blood pressure, and helps maintain a healthy cardiovascular system. Supplemental L-arginine is mainly used to achieve the benefits derived from converting this amino acid into nitric oxide. Ubiquinol is the reduced form of coenzyme Q10. It's a compound that the mitochondria need to produce energy in your body. The organs with the highest energy demand in your body have the highest levels of CoQ10. These include the heart, the brain, the kidneys, the muscles, and the liver, all of which contain many mitochondria and use a vast amount of energy. The heart is the organ with the highest levels of ubiquinol in the whole body. Supplement daily with ubiquinol, therefore, with a dose of about 10 milligrams per kilogram of weight. It improves heart function and reduces fatigue and difficulties breathing. Ubiquinol also protects the heart from damages due to low blood supply, which happens during heart attacks, for example. And 600 milligrams per day of ubiquinol can also reduce high blood pressure. Vitamin D deficiency has also been associated with an increased risk of cardiovascular disease, including high blood pressure, heart attacks, peripheral arterial disease, and stroke in several studies. Vitamin D deficiency may increase the risk of heart diseases, and regular supplementation with about 10,000 units per day protects the heart and the blood vessels and helps you maintain a normal blood pressure, and also helps the heart not go into hibernation mode. One study showed that vitamin D supplementation may lower blood pressure, improve blood pressure control, and regress even heart enlargement. Similarly, deficiency causes hardening of the arteries, which is called atherosclerosis, and blood vessel dysfunction, which predispose people to cardiovascular diseases. And when you take your vitamin D, supplement it also with vitamin K2 because it increases the vitamin D3 absorbability. 10,000 units of vitamin D3 with 4 capsules of vitamin K2 per day. Vitamin K is a crucial nutrient for calcium metabolism, bone health. It helps you avoid blood clotting and supports heart health also. There's two main types of vitamin K2, MK4 and MK7. Vitamin K2 is involved in blood clotting, bone health, and a regulation of some cellular functions in the human body, and is very important also for regulation of cell growth and maintenance of the arterial walls. Other great supplements are grapeseed extract, also known as OPC, which is a concentrated source of antioxidant polyphenols from the grape seeds. The grape seeds are among the best sources of powerful antioxidants, proanthocyanidins, which build oligomeric proanthocyanidins complexes, or OPCs, with unique antioxidant properties. Apart from free radical protection, this unique mixture of grapeseed components may relieve inflammation and allergies, kill microbes and cancer cells, protect healthy cells against toxins and radiations, and it also supports the heart and the blood vessels, opens up the capillaries, and will help you have warm feet and hands at all times. In 36 patients at risk of high blood pressure, the extract, given in a dosage of 300 milligrams daily for 6 weeks, reduced blood pressure, and in a series of smaller clinical trials with 130 people in total, grapeseed extract lowered the risk of heart disease by lowering oxidative stress and inflammation. OPC also prevents blood clogging and blood vessel hardening, and blood vessels drug-induced damages. It also softens the heart damages or the scars due to previous heart attacks. In deep vein thrombosis, a blood clot from the legs can get stuck in the lungs and can cause a life-threatening condition known as pulmonary embolism. Grapeseed extract, in a study where it was given in a dosage of 400 milligrams daily for 8 weeks, showed great blood thinning effects. And this effect could potentially lower the risk of blood clots and vein thrombosis, which are much more common in older postmenopausal women. And last but certainly not least on a vital supplements list is nattokinase. This is an enzyme present in a traditional fermented Japanese food. It helps dissolve blood clots, and despite its name, nattokinase is not a kinase enzyme, but instead belongs to the serine protease family of enzymes which work to break down other proteins. Nattokinase lowers blood pressure, inhibits the angiotensin-converting enzyme, which causes narrowing of blood vessels, and increases blood pressure. Nattokinase benefits the patients with thrombosis risk, so the formation of the blood clot inside a blood vessel, and a single dose of nattokinase degraded fibrin and decreased levels of coagulation factors which are involved in blood clotting. Its effect lasted also for a very long time in experiments over 8 hours compared to other enzymes like tissue plasminogen activator or urokinase. So daily nattokinase supplementation was much better at reducing blood vessel plaque size. They showed a 36.6% plaque reduction. That causes the hardening of the arteries, or arteriosclerosis, and it was compared here to a statin treatment which only showed an 11.5% plaque reduction. As always, don't self-medicate before getting a proper diagnosis. As you can see, problems with your blood pressure and your heart can have many different causes. Contact us for a remote scan where we can exactly determine what the problem is. And if you have any questions about any of the subjects presented here, please also do not hesitate to get in touch with us. If you've enjoyed this presentation, please support our work by becoming a Patreon or making a small PayPal donation. Links in the description box below. It really helps us out a lot and keeps the channel going. And also do not forget to like, share, subscribe, hit the notification button, the little bell icon, so you get notified whenever a new video appears here. and also get involved in the comment section down below. With all that being said, stay healthy. Until next time.